Hello, everyone. My name is Marcus Sanders, and today I'd like to talk about a population that's near and dear to my heart, given that I am a federal correction officer, and that population is children of incarcerated adults. Um, these children face significant adversities, such as being the children, one, as previously mentioned, of incarcerated adults, but also family disruption and intergenerational inequality. My central argument is that the practice of social work with children of incarcerated parents requires a trauma informed, culturally humble practice response and a strong advocacy for the policies that can help reduce the harm of these children. Children of incarcerated parents are a vulnerable population with unique and specific challenges. For instance, the Institute for Research and Productivity found that more than 6.5 million people in the U.S. are under correctional supervision. Now, that includes incarceration, probation, and parole. This means large number of children are impacted by parents' involvement in the criminal justice system. According to the literature from the Department of Health and Human Services, compared with general population, individuals who are incarcerated more often have mental health disorders and chronic illnesses and histories of trauma. The racial disparities are even more pronounced, where a study in 2019 from the Sentencing Project found that Black Americans represented 14% of the U.S. population, but 33% of the total prison population, and 46% of those who had served at least 10 years. Um, from the social work practice lens, there are several frameworks and values that are especially relevant when working with children of incarcerated parents. Trauma informed care, culturally cultural humility, and the core values of the National Association of Social Workers. Um, such such as services like social justice, dignity, um, worth of a person, importance of human relationships. So if we can imagine a 10-year-old girl whose father is serving 5 years, um, whose mother's working long shifts to make ends meet. She has repeated absences from school. She expresses worry about her father, and she's starting to show signs of anxiety and acting out, behavior. Um, a trauma informed social work response would be recognizing that her distress may be linked to the separation from her father, creating a safe space for the child where they can express their feelings about having their parents being incarcerated and without shame. Using cultural humility, asking about her cultural family context, and recognizing potential mistrust of social systems and trauma from prior experiences. Engaging in the engaging strengths, working with her to identify coping responses, helping her develop age appropriate goals such as improved attendance, safe outlet for emotions, connection with the father if appropriate. Policies and systems and laws affecting incarceration. As social workers, we should practice an advocacy of policy changes such as high incarceration rates and disproportionate impact on communities of people of color. Policies such as mandatory minimums, parole restrictions, bail practices, and limited visitation rights amplify the separation of children and parents and reduce opportunities for family stability and reunification. As social workers, in summary, as social workers, applying trauma informed care, cultural humility, and social work values in practice helps to engage these children and their families in ways that honor their dignity and promote resilience. My call to action is to invite each of us, whether we are working directly with children or working in policy and advocacy or simply reshaping our professional identity to ask, how can I change agent for children whose parents are incarcerated? What system can I help shift? What policy can I help influence? And what individual practice can I improve? Thank you for listening.